For some reason, I don't know if it was that shift in life in terms of going from university and entering the workforce, but I just found that my pain was really overbearing and really overwhelming in my thinking processes. And in hindsight, I probably had a degree of depression at that time. I was really fortunate. I had a family friend who was a GP, and in talking to her about how I was feeling, she suggested that I meet with a psychiatrist. So up until that point, my pain management had really consisted of pain medication, and there had been no attention given to my emotional and psychological well-being and how I was coping with that lifetime of living with severe pain. So I met with a psychiatrist, which in itself was quite a big thing because I think sometimes there's that stigma around psychiatry, and it's one of the best things that I've ever done. And through this doctor, he discussed with me the idea of using cognitive behaviour therapy. And I have to say it was one of the most challenging experiences that I'd ever been through, because for me the idea of CBT is that it taught me to challenge my negative thought processes and the subsequent behaviours that I was carrying out as a result of that negative thinking. I found that CBT wasn't, once I'd learned it, it wasn't a difficult tool or skill to then apply beyond the treatment sessions. And I know this sounds funny, but it really set me free. So the example that really sticks with me is that before I learnt CBT, I felt that because my joints were so sore and so swollen, I felt that when I went into public that people were looking at me. And it skewed my thinking so much that it had a twofold effect. I withdrew socially, but when I did go out, I covered up as much as I could. So in summer, I always wore long sleeves and long pants to cover my joints as much as possible. And through the process of learning CBT, it challenged my thinking about, I guess, the reality of, were people really looking at me? And if they were looking at me, what were the consequences of that? I stopped covering myself up and I felt more confident to go in public, and I resumed socialising, and I felt like I got my life back. It didn't take me long to learn it all. I think my number of appointments with the specialist was less than 10, and I practiced between each appointment. He gave me set exercises to do. So for example, one of my big challenges was going out in public, and in particular catching a bus. I felt that for some reason about being in a closed space on a bus, I felt that everyone was staring at my joints and they could see that I was disabled. And so he would ask me to deliberately catch a bus and to not cover my joints up and to think about the thought processes I was experiencing at that time, and were people really looking at me, and did it really matter if they did notice that I had a disability. And so he got me to practice the skills in everyday functional tasks.